for today's webinar on role of oral dose minoxidil in trichology or hair care therapy. It's my immense pleasure to introduce our expert speaker for today's webinar, that is Dr. Ratnakar Shukla. Dr. Ratnakar Shukla is one of the eminent dermatologists from Gorakhpur and having an experience of more than decade in his clinical and cosmetic dermatological practice. So without wasting not much more time, I request Dr. Ratnakar Shukla to share his experience on role of oral minoxidil in trichology or hair care therapy. Over to you, sir.
Okay, so good evening, everyone. I am Dr. Ratnakar Shukla, a consultant board certified dermatologist practicing in Gorakhpur. And today I am going to give a talk on low dose oral minoxidil and its role in trichology and alopecia. So, yeah. So first of all, a question comes why there is a need of oral minoxidil? Because we already have a topical minoxidil. So there is a gap. Many people want a daily pill, which is much easier than applying a lotion or foam or liquid twice daily. So there is a need of adherence problem, and to counter that, we need OD dose, and there comes the role of low dose oral minoxidil in alopecia. Coming on to the mechanism of action, how it works. So it has a multiple pathway. Most important one is vasodilatory action of the minoxidil. It
Sir,
stimulate the
extremely sorry to interrupt. Sir, your
yeah,
slides are not moving.
slides or
Not moving, sir.
okay. This mechanism of action is displaying.
No.
Okay.
Should I
Uh,
present?
no, I can just give me. Is it visible?
First slide is visible, sir. Just go to
First
next
slide
slide.
is visible. Okay, now it is full screen.
Yeah, first slide is
Okay.
full screen.
Yeah,
But
perfect. Okay, so I'm telling that why there is a need of oral minoxidil. I hope the slides are visible now.
sir, only first slide is there. Sorry to
Yeah,
say.
yeah, yeah, yeah. Okay.
Can you just go to
Yeah,
second slide so that it is
yeah.
moving?
Slides are moving or not?
No, I think no, sir. Sir, should I present?
My screen is shared. Yes, you can present.
If you allow, sir.
Yeah. You can present if it is not moving.
Yeah. Should I say?
Yeah, is it moving now?
Sir, I think it has been freezed. Your
Okay.
slides are. You
Should I
just
join again?
stop share screen. Yeah, and now you share this.
Is it visible now?
Just coming now, go to full screen.
Visible now?
And
Full
go,
screen?
yes, and go to next.
Yeah.
Yes, perfectly all right. Go ahead, sir.
Okay. Yeah, sorry for that glitch. So, yes, I was saying, uh, yeah. So today I'm going to give a talk on low dose oral minoxidil and its role in trichology. First of all, question comes why there is a need of oral minoxidil. Obviously, because many people is not they are not comfortable with applying liquid or foam twice daily, and yeah, so many people find taking a pill daily is far more convenient than applying a liquid or foam twice daily. So because there is a need of adherence, there is so to counter that adherence problem, there is introduction of oral minoxidil. Again, this is not moving. Yeah. Coming on to the mechanism of action, how it works. So, oral minoxidil has a multiple factors through which it has a role in alopecia, out of which the most important one is vasodilatory action. There, it stimulates the ATP sensitive potassium channel receptors, and through which there is an increase in the calcium ion and thereby hyperpolarization, which causes blood vessel to dilate, and thereby this vasodilatory action happens. Because of the vasodilatation, there is improvement and increase in the oxygen and nutrient supply to the hair roots, and it improves the hair growth. Another role is in the WNT beta-catenin signaling pathway, where it acts as an inducer by increasing the vascular endothelial growth factor or by activating it. Third role is in as an anti-inflammatory agent. Minoxidil actually reduces perifollicular microinflammation by inhibiting various inflammatory markers such as interleukin 1 alpha and prostacyclin. It also has an anti-androgen role where it reduces the expression of 5 alpha reductase type 2 gene in human keratinocyte cells, and thereby giving this anti-androgen role. Also, it enhances the synthesis of DNA in the anagen bulb. So, together with all these factors, oral minoxidil impart a hair growth role in the alopecia cases. Coming on to the pharmacokinetics, how oral minoxidil works. So, oral minoxidil, it is a rapidly and almost completely absorption after oral intake, with peak serum level achieves in and around 1 hour. There is a very less amount of the protein binding. It is widely distributed. It with the volume of distribution somewhere around 2 to 3 liter per kg. Metabolism wise, it is primarily metabolized in the liver. Also, it doesn't cross blood-brain barrier, so there is no any CNS kind of side effect. Primarily metabolized in the liver to minoxidil low glucuronide. Also, there is a hydroxylation and sulfation, and minoxidil sulfate derivative is the most important one, which has a role in the alopecia cases. Only 10% of the product excreted unchanged in the urine. So mainly over more than 90% of the minoxidil of oral intake get metabolized in the liver. The elimination half-life is approximately 4.2 hour, that ranges in between 2 to 8 hour. Special population, the active metabolite may accumulate in patient with renal impairment. So that is one contraindication, one relative contraindication. Coming on to the drug interaction aspect, so it is often used as very low dose from 0.25 to 5 mg for alopecia cases, but it is FDA approved for hypertension at a very high dose that varies between 5 mg to 100 mg. A patient can take oral minoxidil in a fade state or fasting state, so there is no interaction with food also. So generally considered, it is a very safe drug, and patient can the compliance is also very good because it is once daily intake. Indication wise, oral minoxidil is used as an off-label agent for both male pattern and female pattern of hair loss for androgenetic alopecia. Along with that, many people used oral minoxidil even for chronic telogen effluvium cases, in lichen planopilaris cases, and in monolithics alopecia areata as well. And often people have got significant improvement in the hair count and hair thickness as well. Coming on to the dosage aspect, for male pattern of alopecia, we generally start with 1.25 mg per day. Often we escalate or updose by 1.25 in around 2 to 3 months if we don't get a desired response. And Maximally, we can go for 5 mg per day for male pattern of androgenetic alopecia. Similarly, for female, we start with 0.625 mg per day, and in the same manner, we escalate to 1.25 and then maximum to 2.5 mg per day. So, overall, female dose is in most of the cases half dose of male pattern. And after initiation of low dose oral minoxidil, if visible hair growth normally seen in and around 3 months, but if there is no satisfactory response even after 3 months of use, then consider updosing by 1.25 in male cases and 1.625 in female cases. Coming on to the clinical evidences, so there are various reviews, case report, meta-analysis where it is clearly showing that when a patient is put on oral minoxidil, there is a good amount of the improvement and good control in the alopecia. Coming on to the side effect and contraindication. So while generally it is very well tolerated drug at low dose, but systemic effect can occur and do occur, out of which the most important is hypertrichosis, and it is mainly experienced by the female. Another important factor is temporary setting. When we start with the minoxidil, uh, for the first 1 to 2 months, for 2 to 6 weeks, a transient increase in hair shedding can occur. So we need to counsel patient for that also. Cardiovascular symptoms. Obviously, these are very rare at low doses, but it may include lightheadedness, headache, fluid retention, especially the ankle edema, or sometimes even a palpation. Contraindication, it is generally and it should be avoided by the pregnant or breastfeeding female, and for those patient with a certain heart or kidney condition, or a very elderly patient with heart anomaly or abnormality. Monitoring guidelines, there is no recommendation for monitoring because it is considered as a very safe drug. Monitor only if a patient is put on any antihypertensive medication, patient is of known case of hypertension, or patient complains of any associated side effect or symptoms. Warning and precautions. Always consult a cardiologist before prescribing low-dose oral minoxidil to a patient with a history of heart disorder and particularly in elderly. Now, I had come to the end of this presentation, and I'm going to give few of the product details as well. So here comes a tablet from the hetero company Minustrong, which is available in both 1.25 and 2.5 strength. These are score tablets so that patient can take it easily. And Minustrong is also available in the solution form in both 5% and 10%, and along with the combination of finasteride. With this, I would like to say thank you for patient listening. I'm open to any question or any discussion if anyone is having. Thank you so much.
Yeah, dear audience, just request you can put your questions in chat box. Uh, uh, so the first question came as, what is the therapeutics index minoxidil tablets or any side in female?
Pardon?
Therapeutic index of minoxidil tablet
Mm-hmm.
in female. Any guidance on this?
Yeah, so for female also, as I already told, we start with 0.625, and generally it is mainly given for the female pattern hair loss, because we know that we don't have any good drug available for the female pattern of the hair loss. We cannot give finasteride in the young females. So we can give this tablet starting with a very less dosing. The starting dose is 0.625, and when a patient is getting a good amount of improvement, then we can continue with on the same dose. In case if patient is not experiencing significant growth, then we can updose it also to 1.25, and it is a very safe drug, so we can continue with it almost for 6 months to 1 year to 2 year. Only thing is, patient sometimes complain of increase in the hair over their facial face, predominantly over mustache and beard area. So that is one concern where we need to stop or de-escalate the dosing. So that is one thing only. Otherwise, it is considered as a very safe drug and we can give.
Actually, the same on similar lines, Dr. Ram has just escalated the question: is there any oral minoxidil enhances the growth on body hair, growth of
Yes,
body hair?
so yes, going by the theory concept, yes, because there is a this hypertrichosis is a side effect. So in and around 10 to 20% of the uh, people do experience hypertrichosis, but it is not like everyone is getting the hypertrichosis also. So the dose is very low. So in such dosing, getting an increase here over every body area is very difficult. But yes, as a side effect, sometimes people do experience, and few people can complain of increase in body hair also.
So there is one more question that how long oral minoxidil does takes to see the results, actual results?
Okay, so by the end of third month, most of the people will get result, and if patient is not getting result even after using 3 months of oral minoxidil, then either you need to escalate the dose to dose, or you need to switch to another drug. But if you are getting this result, then you can continue for a longer duration.
Okay, it's nice given answer, sir. There is one more question which is there. Since it is, as you mentioned in your talk also, so does this affect the blood pressure?
See, the dose we which we use in alopecia is very low dose. It is generally given from variable from zero point 0.625 to 1.25, then 2.5 and 5 mg maximum we go. So in such dosing, it doesn't give any significant blood lower the blood pressure, because what dose we use for as an antihypertensive drug is variable from 10 to 40 mg. Yes, 2 to 4 mg, 2 to 4 mmHg pressure can be reduced even at this dose also, but that is very negligible effect. So we are generally very sure that okay, at this dosing, it is not going to give you any kind of significant serious hypotension or any such thing. So overall, it is a very safe drug from that point of view also.
So in continuation, there are two questions actually. One is this a US FDA approved? That is
Okay.
first. And second, if a pedal edema or tachycardia occurs on minoxidil, do we need to stop or taper the dose?
Okay, so no, it is not FDA approved drug. It is an used as an off-label agent, as an adjunct option. But yes, minoxidil as an antihypertensive agent is FDA approved. So when a drug is already approved at an high dose, we we can safely use it at low dose, because people are using the cardiologists using this drug at a high dose, and that is FDA approved, and we are using comparatively very less amount of the dose. Coming on, yes, your second question was in.
If a pedal edema or
Yeah,
tachycardia
yeah,
occurs on minoxidil,
yes.
do we stop or taper the dose?
So for that, we need to check whether patient is on what dose. If patient is on very less amount of dose, say for 0.625 or 1.25, we should stop the drug. We should refer patient to a cardiologist to rule out the actual reason of the ankle edema, pedal edema, or palpitation, whether patient is having any associated any other cardiac history or any cardiac disease or not. But if patient is developing all such side effect at a very high dose in alopecia range, like say for at 5 mg or something like that, then obviously we can try to reduce the dose and see whether we are getting reduction in the side effect or not. If yes, we can continue by at very low dose like 0.625 or 1.25 to maintain. But even at this dose, if patient is getting, it is always better to stop the drug and refer patient to cardiologist to rule out any significant cardiac history.
Great. It was a nice discussion, sir, going on. One more question has come. Can topical and oral minoxidil can be taken together? What is your experience says?
Yeah, so many of the doctor do prescribe together also, but there is no ethical say when a patient is already on topical minoxidil. By adding oral minoxidil, we are not giving any added benefit. Only thing is, if a patient is having some sulfur transferase enzyme where topical is not working, then you can switch to oral drug, or you can switch to sulfate booster so that the derivative gets reduced. So in such scenario, there can be a role of otherwise, in my personal point of view, either you should choose oral minoxidil or you should choose topical minoxidil. Same drug in two different form, I don't think is going to give any better effect.
Yeah, actually means it depends upon the clinical judgment and diagnosis when to start
Yeah.
and patient adherence. I will say whether to
Yeah,
go
and
with.
in fact, many times few group of patient they want कि सर हमें oral tablet नहीं चाहिए, हमें कुछ लगाने के लिए दे दो. In such scenario, you should prefer topical form. Many times patient कह नहीं नहीं ये बहुत problematic है, morning में लगाओ, evening में लगाओ. In such scenario, you can give the oral tablet. So you should use your clinical judgment, and accordingly as per patient wish also you can categorize.
Again, sir, how long it can be means like there is one myth coming in that if somebody started minoxidil, it is a lifelong therapy. So, is there a such kind of conditions associated with oral minoxidil also, or again it is a different school of
Okay,
thought?
so oral minoxidil is not very like old drug. In fact, almost 8 to 10 years since it is started getting used for alopecia. So whatever data we have till now, it is very well safely given for almost 4 5 year to a patient, and there is no any
Wow.
side effect. So obviously we can continue, but only thing is even after sometimes patient also get fed up कि कब तक दवा खाएं. So whenever you get a desired clinical response, you can plan to taper it off rather than switching it abruptly. From OD dose, you can do alternate day therapy, then you can do weekend therapy. So you are giving that 3 days or 4 days of without any drug also. You can switch to topical from oral. So in a way, you can give something to boost hair growth as well as, and you can slightly tapering or lowering the drug. And finally, if the hair growth is good, there is no hair loss experiencing by the patient, then you can switch it off also.
Okay. So looking into the current scenario, one more question has come that how do you say as an expert where to place what is the place of this particular oral minoxidil in the therapy? Means where to use lotions, where to use oral minoxidil. Means your expert opinion on this.
Okay, so see, obviously the topical minoxidil is an FDA approved drug, and oral finasteride is an FDA approved drug. Where and this low dose oral minoxidil is still used as an off-label agent. So till the time it is not getting approved for alopecia by FDA, we can use only as a second line option, as an add-on option, as a adjunctive option in a subgroup of patient who are not comfortable with the topical minoxidil, who have any compliant issue with topical minoxidil, patient who are not getting good amount of result with topical peptides and hair nutraceuticals. You can switch to oral minoxidil. So in such scenario, you can use as an add-on option.
Okay. So
But
particularly
my
means it will be. Yeah.
Yeah, but my personal experience is till now, I have used it in FPHL and patient are very well satisfied. They are getting improvement. The hair density is getting increased. So yes, I'm using it repeatedly for FPHL patient as well as for male pattern of androgenetic alopecia.
Acha. With your experience, sir, means particularly male pattern androgenetic alopecia is the where I will say not ideal, but the indication where this oral minoxidil will works uh, with your expert's opinion, right?
Yes.
Sir, just a request, if possible, will it be possible to share your one of or couple of experience with how do you have started the oral minoxidil on the patient and actually you have seen the results maybe 3 months, 6 months down the line, and so that our audience will be having more practical experience from
Yeah,
your
yeah, sure, sure. So I'm
yeah.
experience. I'm giving you two case scenario. Actually, both are my patients. So one patient who is using already topical minoxidil from some other doctor, prescribed by some other consultant, but is not very happy with it because he is experiencing irritation, dryness, roughness. Already he is having dandruff issue. So he came to me and said कि सर मैं टॉपिकल मिनॉक्सिडिल लगा के परेशान रहता हूँ, मेरा हेयर स्टिकी रहता है, ड्राई हो जाता है, इरिटेशन होता है और मुझे टॉपिकल नहीं चाहिए सर, प्लीज पुट मी ऑन ओरल टैबलेट्स ओनली. So there comes the role of oral minoxidil. So I had put this patient into the on oral finasteride and oral minoxidil and just stop topical minoxidil and switched patient to topical peptide combination. And patient is very happy because that irritation part is now over. Patient is hair loss is also well controlled. He is experiencing hair density is getting improved. So this is one scenario. And second example I would like to share that one of my female patient where she is not getting improvement, and I have started at very low dose because many times many even consultant fear of having a fear of minoxidil. They don't want to use minoxidil. So that is again a hindrance. I would like to encourage everyone to start using oral minoxidil, in fact, for FPHL cases, because in such scenario, this is a very good drug. Start with a very low dose, very less dose. Start with 0.625 and continue with that. After 3 months, again, recheck the patient how she is getting improved or not. You can escalate to 1.25. So in many cases patient are very happy with this, and my patient was also very happy with this. Her scalp visibility becomes very much reduced, so she was happy. Yeah.
Thank you, sir, for sharing your experience. Actually, it is not audience; it is my just a question
Okay.
related with this your
Okay.
case.
Okay. Okay.
Sir, when you see the overall improvement in patient, so what are general parameters do you observe? Because it is a long-term process. Is it not overnight that we can see the result like any other condition? But what are your
Yeah.
parameters where you will observe that yes, it shows the improvement in patient?
Okay, so see, there are two things. One as a private practitioner, and one when you are in academic institution. So whenever you are in academic institution, you have resident with you, so you can do like on the same point, you can take a trichoscopy analysis where you can count hair number, hair thickness. Myself, even in my PC, I used to do that. I used to mark a point 5 centimeter from this point, 5 centimeter from that, then mark, then take a photograph, do the trichoscopy, and then count here in the 1 centimeter square area. Then again on the next visit, I do the same, and then we used to compare. So from that, we used to get ki okay, at first visit, patient is having 13 hair count in that area. Now the hair count is 19. So obviously we are getting improved result into that. Then for hair thickness also, okay. So we have a trichoscan analysis also. So from that we came to okay, the hair diameter is 0.13 mm. Now it is 0.17 mm. So hair thickness is also getting improved. But when you are into private practice, this is just not possible. It is very difficult. So in a private practice, we just take pictures from the top view, from the front view, and I also ask from the patient to take your picture and keep a folder in your mobile. Then again, after 3 months, we again take a picture. We compare those two pictures so that we can show patient also ki look, this area is looking bald at your earlier visit, and now there is a richer density. Now this scalp is visibility had reduced. So in that way, patient is also convinced. Patient is also happy कि okay, मुझे result आ रहा है, मेरा दिख रहा है. So that way we both are comfortable.
Right, definitely, sir. It will be definitely different things to be followed in medical college
Yeah.
and private practice because of the technical experts and colleagues
Yes.
and all these things.
Yes.
But it is good to see have the improvement. There are lot many parameters. Sir, just one more question. As a expert, what do you suggest that how one clinician should go about? Because counseling, I think, feels a more important role when it comes
Yes.
for the minoxidil.
Yes.
So,
Yes.
what are the certain things which, as a expert, we should colleague should follow during
Yeah.
their practice? You are
Yeah. So for alopecia, counseling is a very important. Counseling has a very important role because if we are not going to counsel, maybe possible that patient is going to stop treatment at the first month itself. Because when anyone start using minoxidil, there is certain increase in the hair loss, and many patient get fed up with that कि सर मैंने आपकी दवा यूज की and suddenly मेरा hair तो और भी गिरने लगा. So I always counsel, I always tell my patient कि I am starting your medicine, but you are not going to get any kind of result in next 2 months. So you have to be patient with that. उससे डरना नहीं है. You should continue with this medicine, and if you can continue with this medicine, only then in the third month you are going to get you are started developing result. You are going to see some kind of result, and when you can continue, then फ्रॉम थर्ड मंथ ऑनवर्ड, इन फोर्थ मंथ फिफ्थ मंथ आपकी हेयर डेंसिटी अच्छी होगी, हेयर थिकनेस अच्छा होगा, और धीरे धीरे आपको बहुत अच्छा रिजल्ट मिलेगा. सो बाय काउंसलिंग दिस आई बाईपास दीज फर्स्ट 2 मंथ का जो भी क्वेश्चन है जो हम लोग के पास आता है. सो वो बाईपास हो जाता है, एंड देन सो काउंसलिंग इज वेरी वेरी इंपॉर्टेंट. And with minoxidil, sometimes what nowadays patient already using Google, Chat GPT, AI, and they came with ki sir, we are using minoxidil, we are using finasteride. फिर there are so many side effect with finasteride, so many side effect with minoxidil. I have ordered some minoxidil from Traya, from some this company, some the so many such kind of patient do keeps on coming. So we need to counsel कि you first visit a dermatologist, because there is not always necessary that you have androgenetic alopecia and you can start taking drug on your own. There are so many n number of hair loss disorder. Maybe possible you have a telogen effluvium. Maybe possible you have alopecia areata, where there is no role of giving all such things. We can treat you better with the immunomodulator and immunosuppressant. There is so many cases of cicatricial alopecia. Again, there is no big role of minoxidil also. So we need to counsel all such things also. Okay, always consult a dermatologist, so you yourself get diagnosed first, and then whatever be the best treatment possible that is suggested by the dermatologist, you have to follow that. So yes, sometimes even we have to take extra effort to counsel such patient.
definitely, sir, because all patients are not that much same. Because nowadays, as you
Yeah.
said, AI is something which
Yeah,
giving more
yeah.
information which is not required actually for
Yeah,
certain state. But
yeah.
yes, it is the current state. Sir, meanwhile, one question has just came that since you have mentioned in your talk that it, as far as oral minoxidil is concerned, there is no any such a condition specifically where it has to be given for so many days or this thing. So
Yeah.
during the course, if it has been suddenly stopped taking, so is there any harm to the patient or
So there is no any harm to the patient. Only thing is कि once we start giving minoxidil or any kind of hair loss therapy, and when we suddenly stop all the therapy, then there is a chances that hair loss can again stimulate, and hair loss can again start. So that is why I always consult, I always counsel, and I always suggest कि don't stop abruptly, always taper it down, so that even during tapering we can able to manage your hair loss and patient don't experience again the same kind of situation where patient is experiencing a severe hair fall pattern.
Even one of also doctor has asked one more question. Is there any possibility that if a normal patient is starting with oral minoxidil, will he get a high BP problem? That is question number one. And followed by, is minoxidil tablet gives better hair growth compared to plain biotin preparations?
Okay, so see, minoxidil is an anti-hypertensive medicine. So if uh, a patient on minoxidil is going to get hypertension, I don't think that is going to be a situation from any kind. Patient can develop a little bit of hypotension, but hypertension, this drug is used for hypertension. So there is no point patient where develop hypertension after using oral minoxidil. And yeah, second point is,
Is minoxidil tablet gives better hair growth as compared with biotin preparations?
okay, yeah. So with biotin, because this is hair nutraceuticals, and biotin is not going to give you any. There is not very case report, not very studies available where biotin is helpful in pattern form of alopecia. A patient is experiencing any nutritional deficiency or any kind of telogen effluvium cases where in such scenario, biotin has a role, but biotin will not going to give you a major boost in androgenetic alopecia. Whereas minoxidil has a role in controlling androgenetic alopecia. As I had shown in my presentation, there are various multiple pathway. It can stimulate WNT beta catenin signaling pathway, and that is one of the important signaling pathway in the hair development. Then by inducing vasodilatation, it also promote the oxygen supply and nutrient supply to the hair root. So obviously, if I have to compare between biotin and minoxidil, minoxidil has a upper role, but for telogen effluvium cases, for temporary shedding cases, biotin do have a role. And if a patient is experiencing any kind of nutritional deficiency, there comes the role of the nutraceutical preparation, including biotin and other cyclical nutrition therapy.
So, audience, any questions, you can just put it in the chat box.
And
We
one
are
more
at the last.
point I would
Yeah.
like to add, in our scenario, like in Indian people, I feel 99% of the patient is always low on nutrient. So that is another thing. So this is not directly related, but when we put patient on biotin therapy or a hair nutraceutical, it is going to give you a benefit. It is going to give a boost to your hair as well, along with the body needs as well.
Yes, sir. I think there are no any questions. But sir, at last phase, as you have excellent given guidance, information on various aspects. But before we are moving to the last phase of closing, just I want request you to any key points or key message do you want to give to the audience as a summary so that they will take away during their practice and it will be helpful for them.
Okay, so as I said, one of the important point is many of the doctors, many of the dermatologists, some having some kind of hindrance for prescribing minoxidil. I think people have to overcome that and start using minoxidil. Do take a proper history. Do rule out any kind of cardiac disorder or not. And one patient is free from all such factors, then you can always put patient on low dose oral minoxidil, and it is going to give you a good improvement in your hair loss patient. And second
Yes.
factor is counseling. That is the most important thing.
So right, I think there are no any questions pending in chat box. So now I take once again opportunity to say thank you so much for all the participants who have taken a time and attended this webinar. And today's webinar, which was on role of actually oral minoxidil in hair care therapy, and Dr. Ratnakar has given a good guidance, suggestions, and his clinical experience. And I'm sure that today's discussion and knowledge sharing by Dr. Ratnakar will definitely help you all in your day-to-day practice. And definitely, we look forward for remaining your trusted partners, not just in healthcare, but in life care also. So thank you so much for attending this webinar and have a good evening ahead. So thank you all. Now we are closing the webinar.
Thank you so much for having me. It is a wonderful interacting with you all, and I hope I am able to answer